Hello, everyone. Thank you for taking the time to join me today. The topic I'll be discussing is the World Health Organization's response to the COVID-19 pandemic. This presentation will explore the organization's critical role during one of the most challenging global health crises in recent history. I'll dive into the details of the event, how it connects to broader themes we've studied, how it was portrayed in the media, and its implications for international organizations moving forward. I encourage you to reflect on the points I raise and consider the lessons we have learned from this unprecedented time. Slide 2. Let's start by revisiting the timeline of the monumental event. On January 30th, 2020, the World Health Organization declared COVID-19 a public health emergency and international concern, or PHEIC for short. At this stage, the virus was rapidly spreading across multiple countries, but the situation hadn't yet categorized itself as a pandemic. That changed on March 11th, 2020, when the World Health Organization labeled it as such. This announcement made a pivotal moment in global health history. From that point on, the World Health Organization was at the forefront of the response, coordinating international efforts to slow the spread of the virus, protect valuable and vulnerable populations, and develop solutions to mitigate its impacts. Some of their key actions include including some of their key actions included issuing public health guidances, like recommendations for mask wearing and social distancing, facilitating resources and allocation for testing and treatment, and launching the COVAX initiative to ensure equitable vaccine distribution around the world. However, these efforts were exposed to some critical challenges. For example, while the World Health Organization worked to provide a unified response, it faced criticism and delays in issuing warnings and its reliance on data from member states, which was sometimes incomplete or inaccurate. These issues highlighted both the strength and limitations of the global health governance system in a rapid evolving crisis. Let's talk about how this event relates to the course. This event is a clear case study in global governance and the role of the international law in managing public health emergencies. Specifically, the International Health Regulations, or IHR, serve as a legal framework for the World Health Organization's actions. These regulations were established in 2005 and are designed to guide member states in preventing and responding to global health threats. The pandemic also underscores the importance of multilateralism, countries coming together to address shared challenges. While this concept is ideal in the theory of COVID-19 crisis, it revealed some of the limitations in the practice. For example, we saw disparities in vaccine access between high-income and low-income nations, despite efforts of COVAX to address this issue. This raised questions about whether the current system truly fosters equity or if it is disproportionately benefits wealthier nations. In this context, the World Health Organization's role becomes even more critical. It serves a platform for international collaboration, but the pandemic also showed the organizers' effectiveness depending on the willingness of member states to cooperate and share resources. This is an interplay between global governance and national interest in reoccurring themes is a reoccurring theme in our coursework. And the COVID-19 pandemic provides a real-world example of the complexities of this kind of issue that we've covered in our class. Moving on. Media representation. The way this event was portrayed evolved significantly over time. When the pandemic was first declared, headlines like World Health Organization declares COVID-19 a pandemic emphasized the urgency of the situation. Media outlets use visuals such as graphs, maps, and real-time trackers to convey the rapid spread of the virus and its impacts on different regions. These tools were effective in communicating the scale of the crisis. As time went on, the media shifted its focus to including more human interest stories. We saw profiles of healthcare workers on the front line, stories about their families affected by COVID and the virus, and reports of challenges of vaccine distribution. These narratives added an emotional dimension to the coverage, helping audiences to connect with the human side of the pandemic. However, the media also faced challenges in maintaining objectivity. For example, some outlets were accused of biases in their reporting, particularly regarding the World Health Organization's initial response to the crisis. There were debates about whether the organization had been too slow to act or too reliant on data from specific countries. Additionally, public health guidance, such as mask mandates and vaccine safety, was sometimes misinterpreted or politicized in the media, which contributed to the public confusion and mistrust. Despite all these challenges, the media played a crucial role in keeping the public informed and engaged during this time of uncertainty. It also served as a platform for holding organizations like the World Health Organization accountable for their actions. Let's talk about the significance of this event. First and foremost, the COVID-19 pandemic exposed significant inequities in global health systems. While some countries had the resources to implement widespread testing, secure vaccine supplies, and provide financial support to their citizens, others struggled to meet even the most basic needs for their people. This disparity raised important questions about the fairness of our global health organization systems and the role of international organizations in addressing these types of inequities. One of the most valuable lessons in this event is the importance of transparency, communication. Throughout the pandemic, misinformation and disinformation spread rapidly, often undermining public trust in health authorities. The World Health Organization and other organizations face the difficult task of combating false narratives while delivering accurate information in a rapidly changing situation. Another takeaway is the need for stronger enforcement of international health regulations. The IHR provided a framework, but it lacks mechanisms to ensure its compliance. For example, there's no penalty for countries that fail to report outbreaks promptly or share critical data. Strengthening these mechanisms could improve global preparedness for future health crises, such as a new and emerging pandemic in the next decade. Now is a time for reflection and questions. This brings us to some of the broader reflections. One of the questions to consider is how the international organizations like the World Health Organization is able to balance political neutrality with the need for provocation measures. Should the World Health Organization have greater authority to enforce global health measures, or would that infringe on the sovereignty of individual nations? I also invite you to think about what changes could improve future pandemic responses. For example, how can we ensure that resources are distributed more equitably? And how can we build a stronger system for combating misinformation? Finally, I'd like to ask, how has this event changed your perspective of the international organizations? Do you see them as essential players in addressing global challenges, or do you think that their limitations outweigh their benefits? These are complex questions that are more important but they're more important for understanding the role of organizations like the World Health Organization in shaping our world. Alrighty. To conclude, the World Health Organization's response to the COVID-19 pandemic was a monumental effort that highlighted both the capabilities and limitations of global health governance. The organization played a critical role in coordinating international efforts, providing guidance, and distributing resources. However, the pandemic also exposed significant challenges from inequities in vaccine access to the spread of misinformation. As we move forward, it's essential to learn from these experiences and work towards a stronger and more equitable system for addressing global health crises. I appreciate your time. Thank you for listening, and I look forward to any questions or discussions you may have about this topic. And here are my sources. Thank you so much. Have a good one.